So it was Friday morning, September 24th. Woke up in the morning. I felt sudden fatigue, tightness in my chest, almost like really bad heartburn. But then from there, I had some shooting pain down my left hand. I just completely felt off. And then my jaw went numb.
Margarita's case in particular, she presented with chest pain, and the emergency department saw what looked like an evolving heart attack.
They came back to me and said, you had a heart attack. And it was just moving so fast. And then they said, okay, we're going to take you to the cath lab. We don't know when. And then that turned into, we're going right now.
Cardiac cath lab is a specialty department within the hospital that deals with the minimally invasive treatment of heart attacks, coronary disease, and arrhythmias.
And I was getting ready to go into the cath lab. And when I remember saying it, I was like, I'm scared. It was a moment. I told my husband the worst thing I could have ever said to him was, if something happens to me, take care of our boys. He informed me he was consulting with other cardiologists while he was in procedure to figure out the best way to treat it.
The artery was closing right in front of my eyes, and I had to put a stent in and repair the artery.
They informed us that I was diagnosed with SCAD, which is spontaneous coronary artery dissection.
A SCAD heart attack is a form of a heart attack where the inner lining of the artery tears.
I was at a loss for words. He even drew me a picture, which I still have today. Grateful that I had stepped into the ER when I did. I have 2 boys, one of which is 7 and one of which is 10. And in that morning, he had a lot of questions. I mean, what would have happened if he wouldn't have gone to the doctor? I said, well, we're not going to think about that or talk about that because mommy went. And now they give me medicine to help my heartbeat. All these new physicians that are part of my life now, I met through White Plains Hospital. And for that, I'm forever grateful. Dr. Balagos and his team were very, very exceptional and just human and I could relate to them.
It's treating patients like her that gives us that reward and keeps us going. I lost my father to heart disease. And to me, it's a personal connection to all these patients that I treat on a daily basis.
You don't think a heart attack fits my profile, but it doesn't discriminate. Be very much in tune with your body and what you're feeling and don't self-diagnose. Because had I self-diagnosed that morning, who knows where I would have been or where I would be.